Well, welcome to those who are watching our recording. I'm Dr. Leah Jeanette, and I'm joined by Dr. Eileen Anderson. And we are so excited to have a brief conversation talking about our medicine, society, and culture concentration within the Master of Arts in Bioethics and Medical Humanities program here at Case Western Reserve University. So, Dr. Anderson, would you like to quickly introduce yourself?
Sure. Hi, I'm Eileen Anderson, and I'm a medical and psychological anthropologist here in the Department of Bioethics at Case Western Reserve. I am the Director of Educational Programs in the department, and I am the founding director of the Medicine, Society, and Culture concentration, and I teach within that concentration and within the program.
Thank you. So, as I said earlier, I'm Dr. Leah Jeanette. I'm the director of our Master's in Bioethics and Medical Humanities program and the Associate Director of Educational Programs. My background is actually clinical ethics. I actually am an alum of the Master's program, class of 2009. And since then, I went on and got my PhD in bioethics, focusing in clinical ethics. And I'm also a clinical ethicist at University Hospitals, which is right next door to our campus. So, Dr. Anderson, one of the things I think that we often get asked is why study bioethics and medical humanities? And how do you typically respond to that?
Well, one of the ways in which I respond is that this is the future of what we need in healthcare. That healthcare, as the slide says, healthcare and thinking about health and illness and healing and suffering impacts us all. And as our technologies are getting better, our AI is getting better, some of our biggest questions are in the realm of ethics and humanities and social questions. So, not can we intervene, but should we intervene? How should we intervene? For whom? In what ways? What are the underlying values that inform our research, our policy, our practice? Thinking about, and this is where MSc comes in with a lot of the analytics, thinking about things like social justice and how are health equity and health inequality structured in a society to begin with. And then the bioethics comes in with how do we ensure justice and respect for persons in our research, our clinical practice, and in our policymaking.
So, kind of the question I want to ask you next really is a great segue off of what you were just saying. So, when we talk specifically about medicine, society, and culture, what are medical humanities, social medicine, and ultimately, why do these things matter given what you just kind of shared?
Yeah, it's a great question. Sometimes when I get asked that question, I gloss it this way. It's kind of all the non-biological aspects of health, right? And we are looking in MSc, we're looking across, we call medicine, society, and culture MSc for short. We are looking at medical social sciences, medical and health humanities, and arts in medicine. So we're taking structural level social sciences, individual level social sciences. We're looking through humanistic lenses and artistic lenses to understand the human experience of health and suffering and how that impacts actual health outcomes. So for example, in one of our core seminars that we were just meeting about what are we going to teach this fall, and we're looking at issues like stigma, right? If a disease is stigmatized, having nothing to do with the biology per se, just how people perceive it, then people are less likely to go and seek out early intervention. And that really changes the course of so many diseases and illnesses. So there's so many aspects like that. We think about the sick role itself. What is a diagnosis? What do we call our disease? How do people's beliefs impact What happens in healthcare and our disease outcomes? What is the role of narrative? What's narrative medicine? How do the metaphors that we use to conceptualize our own health or illness or the medical system actually impact what happens on the ground and different outcomes? So there's just a ton of questions where we are really well served taking lenses from the social sciences, from humanities, and from the arts, and looking at these questions in health and healthcare using the tools of these different areas. Or we might look at the power of something like a film or a novel to spread a remarkable amount of information about a healthcare practice, a condition, or opportunities for well-being.
So, in light of talking about these fields themselves, how does studying these things, bioethics, medical humanities, medicine studying culture, social medicine, all of these things, assist or impact, affect a student's career path?
Oh, there are so many ways. So, kind of on the most basic level, this kind of credential is something that is increasingly valued in healthcare today and in lots of allied health professions, and other kinds of pathways, perhaps a legal pathway or other types of pathways that people may choose. Because with this credential, employers or other types of programs that people might go on to understand that somebody can do an ethical analysis, really understands how to get down to what are the values driving the particular topic that we're dealing with. They show a level of analytic thinking that our students know how to think about societal structure. They know how to think about institutions like medicine or the law and how those structure people's perhaps access to healthcare or experiences. And they know how to listen to individuals. They know how to hear a narrative and learn from that narrative what needs done in a treatment or even to refine a policy. They understand individual clinical ethics. And so I think that multi-level analytic capacity is one of the things that helps our students regardless of the career path that they end up taking. We hear that back a lot, whether they're going on to be doctors or another type of healthcare practitioner, they're working in law, they're going on to a PhD, they're working in a nonprofit, perhaps even becoming a clinical ethicist. This kind of breadth and depth is powerful in terms of success in the next step of their career.
I will add one particular area that I think our program does really well for us coming alongside students when it comes to their career paths is this idea of discernment. And
Yes.
so it really allows students who maybe have a couple of areas they want to work in, or they're not exactly sure what direction they want to go, but they know it's health related or social medicine related or some type of arts related, and they're not exactly sure what the next step is for them. A program like ours is incredibly valuable when it comes to discernment.
I totally agree. And I think part of that is the content of the course, and part of it is the different experiences that all of our students gain exposure to across the course of the 1 year or 9 month really program. So Our students are in the clinics. They are getting hands-on experience. They are watching clinical ethicists. They're watching chaplains. They might be in a federally qualified health center. Now, through the Medicine, Society, and Culture concentration, students have a wide array of options for a spring practica that they can pair with a fall practica in being in the clinic and doing clinical ethics rotations. So I think you're right. There's so many aspects of the program that really expose students to like a full 360 of what is involved in thinking about health and healthcare today.
So going off of that, let's talk a little bit more about the details of the master's program. So I think one of the exciting things to continually mention is that we'll be celebrating 30 years of our master's program this fall. That makes us one of the oldest masters in bioethics and medical humanities programs in the country, actually maybe even the world, which I think is pretty incredible. And it goes to show how we've been able to grow our program over those 30 years, both in depth and breadth. And so
Yes.
because of that, we have a very customized curriculum for 30 credits, but approximately half of those are electives. There's 160 hours of clinical ethics rotations. There's short-term study abroad courses for 3 credits that students can travel to other places. We have personalized advising for our students. It allows them to sit down with an academic advisor and think through what are their goals for the program, what are their goals beyond the program, and how are those things lining up to allow them to grow in their career trajectory.
And I will say one of the exciting things about having 30 years of this program is having well over 1,000 alums all over the country and all over the world. So it is so exciting to connect our current students with recent alums, alums that are very established in their career path. So it's most of our students, when they start to get a sense of what they want to do, or they're wondering, do I want to go in this direction or this direction? We connect them with our alums, and there's just this incredible networking that has happened over all of these years, and faculty alums too. It's been a wonderful community.
So for our curriculum, by default, all students are in what we call the traditional program, meaning they take our required courses, Foundations 1, Foundations 2, their first semester of clinicals, and the capstone. And then from there, everything else is electives and their second semester of clinicals. For students who are specifically interested in other areas, like medicine, society, and culture, or health policy, or research ethics, they can more specifically focus in on those areas for their electives underneath those concentrations. So, Dr. Anderson, can you talk specifically about the courses and the optional practicum that students can do under the medicine, society, and culture concentration?
Absolutely. So in the fall, all of our medicine, society, and culture concentrators take an intensive 3 credit seminar. This fall, I'm teaching it, but it will rotate through our MSc related faculty who are leading scholars in medical social sciences, in health humanities, and in arts and medicine. And we look through, over the course of the semester, we're reading materials and being exposed to things like artwork and film as well. In depth from different disciplines on the different kinds of themes I mentioned earlier in this webinar, so that by the end of the semester, these students have a really good sense of the foundational readings in social medicine and health humanities, but they are also getting exposure to contemporary cutting edge research. They're getting to know our faculty across all these different areas and having some experiences that are really unique to what we can offer here on our campus in Cleveland, Ohio, that abuts cultural gems such as the Cleveland Museum of Art, where our MSc concentrators are trained in the art of seeing by one of our amazing art history professors. So this is our kind of in-depth, bringing everyone on the same page, knowing the core of what you need to know, whether you're going one direction or another. We also offer a 1.5 credit seminar in medicine, society, and culture that is really for breadth. It's to get students out across the campus, out into the community, into our cultural institutions, really having a personalized exploration of the wide diversity of what is considered part of things relating to medicine, society, and culture. That tends to be a student favorite as they get to explore things that they love, and it's actually part of course credit. We offer a ton of electives within our department in the School of Medicine and across the university that will count for your medicine, society, and culture electives. We also, all of our students in the fall participate in the clinical rotations that are so important to our program. And then in the spring, the student would work with their advisor and probably with me as well to figure out where is the best placement for them. Perhaps they want to go into another hospital setting. But we also, so for example, this past year, one of our MSc students was embedded in the Cleveland Museum of Natural History. There, she was actually working with collections, working with curators, and working through some of the ethics in the collections there and spending time learning about what goes on at a museum. We have students who will embed in research projects in the Department of Public Health, as it says on the slide, with some amazing library opportunities, a refugee organization, midwifery, and almost really an infinite choice. It really depends on what that student's interests and career goals are. And we try to match them with something that's going to give them not just academic exposure, but actual, this is what it looks like in the real world. So that when they're ready to take their next step, they've already got some experience and they can feel confident that they're heading into the next step of their passion.
So two things that I want to highlight that are a part of the overall MA program, but students in particular within the MSc concentration really enjoy. One is our clinical ethics rotations. These rotations allow students 80 hours each semester, so 160 total, spending time observing and rounding with different teams and ICUs on the general floors with things like the psych consult team or interdisciplinary teams, attending committee meetings like ethics committee, transplant selection meetings, policy meetings, and even going one-on-one with healthcare professionals, visiting patients, going to meetings, but not just physicians and nurses, but social workers, genetic counselors, chaplains, allied health professionals across the system. And students love this, especially when they're in the MSc, because hospitals have their own culture. They have their own way of going about things. And so not only are they getting clinical experience, but they're getting to see what a hospital culture looks like. And I think by the second semester, what's exciting is they can do a comparison of two different hospital cultures. The second thing I wanted to highlight is our study abroad electives. These are 1 or 2 week international courses where students focus on a particular area in bioethics and medical humanities. And they travel either during winter break, spring break, or in May, just after courses end. We're hopeful this upcoming academic year to offer courses to Paris, France, Granada, Spain, and a potential new course to Birmingham, England, which will actually be co-led by Dr. Anderson. But these are amazing opportunities to consider cross-cultural comparisons and really to take a seat and learn from experts outside of Case Western Reserve or Cleveland hospitals, really to go beyond our borders to think about these different topics.
And these just count as part of your elective credits. So, depending on what students' course load looks like, their other obligations, these can snap together with their schedule to round out some of their elective opportunities.
Yeah. So all that being said, if you're interested in submitting an application for the master's program, we are still taking applications to start the program at the end of August for a fall 25 start. It is a 2-semester program if you complete the program full time. So you start at the end of August, you can graduate in May. As you can see, there's a number of things we require as part of the application. What I would recommend for students that are interested, one of the easiest ways that you can kind of think about, is this program the right fit for me, is to email us, bioethics@case.edu, and schedule a meeting. And I'm happy to talk with you about, is this program the right fit? Is this going to help enhance my career goals? I'm interested in this particular area. What kind of expertise do you have? Opportunities do we have as part of this program? That being said, we are approaching our final deadline, which is August 1st, to submit an application. We do rolling admission, so we still have plenty of seats available for students. And once we have a completed application, it typically takes us at a maximum of 1 to 2 weeks to review and provide a decision. In the summertime, we move a lot quicker because we know that students need to know the admission decision so they can make plans to move to Cleveland if they aren't local to us. So we would encourage you, submit an application, schedule a meeting with me. We'd love to talk with you more about the program as it pertains to you.
And Dr. Jeanette, does a student have to apply for concentration if they think they might be interested in doing one?
They do not. So I think this is a really great question. So students, when they apply, are simply applying to the MA program. Once they're admitted, they can make decisions about concentrations, electives, all of those things as they're planning their fall schedule. So I think that's a really good point. However, if you know that you want to do the MSc or the health policy or the research ethics concentration, you are welcome to include that as part of your application as to why you think this program is a good fit and how you hope to utilize it in your career path.
That sounds great. And I do want to note that every year, a couple of students feel like they really want to do more than one concentration because obviously, medicine, society, and culture has a lot to do with healthcare policy, and both of those have a lot to do with research ethics. So it is possible to do more than one concentration in your MA year. And we've designed it really carefully so that the core requirements do not conflict in case a student is interested, but you're not obligated either. Students can come in and explore and then commit if they so choose.
That's absolutely right. So just as a reminder to anyone watching the recording, you can reach out to us, bioethics@case.edu. I'm the one who primarily checks that inbox, and so I will respond to you, and we can set up a meeting. I can connect you with Dr. Anderson or other faculty, and we hope you consider submitting an application by our August 1st deadline, and join us this upcoming fall.
Wonderful. Thank you so much. Thanks for hosting us, Dr. Jeanette, and thanks to everyone who tuned in.
Thank you so much. Have a great day.